Hello, and welcome to Social Workers Rise, where we inspire social workers to connect, expand their knowledge, and change more lives than they ever thought possible. We will talk everything social work on every level from micro to macro. We are going to hear stories of social workers who are doing big things, learn new skills, and most importantly, give you actionable steps to make a difference today. Let's go. Hello, and welcome to another episode of Social Workers Rise. It is your host, Catherine here. I have a special treat for you. We are here with Milvon Bryson. She is an MSW out of Ohio and a pediatric medical social worker. Yes, so if you love working with children, working with families, and the medical setting all combined into one, then this might be your jam. I want you to listen to this episode if you are even considering going into any of those fields, because this is going to be applicable, because chances are you might run into, if you work with children and families, you might run into a child or family that is sick. And it's helpful to know kind of how the medical systems work and, just a little bit about it. And if you are going in maybe for an interview for a medical social worker position, this may also give you some good insight into what you can expect. So Milvon has worked with children and families since 2003, so she is not a newbie. She's been employed as a pediatric medical social worker for 6 years, and she's specifically working in hematology, oncology, which also includes bone marrow transplant. Welcome to the podcast, Milvon.
Thank you, Catherine, for having me.
Of course, I'm so glad to talk to you because I'm a big fan of medical social work, and I just love that we can be the voice for the patients in a system that is so confusing and easy to get left behind in and easy to get overshadowed. I don't know, what do you love about medical social work?
I love kind of all aspects of it. I love learning the medical terminology, kind of seeing the different medical procedures, working with the families, a lot of times not seeing them at their best, right? When their kids are really sick, but then also seeing them when they get on the other side of that and being able to kind of give them some tools and skills to kind of power through those difficult times. And then also just kind of reassuring the children that it's going to be okay. We're going to get through this, and we're going to see the bright side of it. So that's just kind of some of the stuff I like. And then I enjoy working with all the different providers that I do, and learning different roles from the nurse practitioners, the nurses, all of that, and just really kind of seeing how it all kind of comes to
Definitely. So I skipped ahead a little bit. First, tell us about you, who you are, and what you do.
So again, my name is Milvon Bryson. As Catherine said, I've been working with children since 2003. Started home-based, and then also did some child welfare as well, and then kind of transitioned to the medical social work. It'll be 7 years this year, actually. So definitely, I think my other jobs working in the home definitely geared me and got me prepared for working in the medical social work, and which I think allowed me to really bring a lot of school skills and different viewpoints that I don't think all the time the medical providers think about, because we only see the families for like this much of the time, and whether it's in a hospital setting or in the outpatient clinic settings. I have 5 children. And I am also a Mimi, also known as a grandmother of 2, and with a third on the way. And I am currently seeking my master's in public health as well. So I'm really excited to kind of add that to my tool belt as well. Um, yeah, and on the fun side, when I have free time, which what is that? I enjoy reading and walking. Spending time with family is a big part of what I like to do with my free time when I have it.
Well, you're quite busy, and congratulations on being a Mimi and going back to get another master's degree. Look at you doing it.
Yeah, it's pretty exciting. I was kind of like, oh, do I want to do this? Yes, and I can honestly see how social work and public health merge, and I think a lot of my social work skills will also help me in the public health. I was a macro concentration in social work, so this like actually spoke to my soul of how do I get more public advocacy and all of that. But wasn't really when I made the commitment like, oh wow, like okay, yeah, this will be easy. Didn't realize how much time because it's been a gap, but it's been an enjoyable experience and actually has lightened my fire back for research. So I'm excited in doing various research projects as well.
Nice, nice. That's amazing. Yeah. So many people are interested in macro, and medical social work traditionally is very clinical, very micro, but with the public health, it just expands so much more. What are you hoping to do with that degree?
I'm hoping because there's actually been a lot of focusing from the medical side of looking at the different disparities, focus on the social determinants of health, and really how to give people more equity and access to healthcare. Because unfortunately, in the United States, not everyone has insurance or access to quality medical care. So, what I'm hoping to do is advocate better, kind of get some more programs and systems in place from in the medical side to really kind of help it be more of a streamlined process. So I'm excited about what opportunities I will be able to bring to the hospital system, as well as introducing the hospital system through some research of kind of really identifying where are the gaps, and trying to address those gaps. So I'm really excited about all the opportunities.
Yes, yes. Have you found that your experiences build on one another, because you talked about starting in child welfare and then transitioning into pediatric medical social work and then now going on to public health and macro? Do you feel like all of these experiences have contributed to your success, or is there any kind of experience that you feel has not helped you at all?
No, I actually think, honestly, working in child welfare, I think prepared me for just about anything. You see so many and interface with so many systems, not only just the home, but the community providers, the court system, all of that, all in one, trying to keep children safe, right? And I feel like that really kind of taught me some skills on how to kind of dig a little deeper because again we only see a snapshot of these families when they come into the hospital system, whether it's inpatient, outpatient, but just really being able to see there's something else more there. What else is going on? How can I better help you? And I think being a macro social worker, even though it is very clinical at times, I am able to do a lot of macro things, and I have. I've you know advocated in being in hematology. One of the largest hematological disorders is sickle cell disease, which is underrepresented. There's lack of awareness. I've done a lot with advocating, educating providers on the importance of decreasing stigmas for this patient population. We've grown our program to where now we're also seeing adults, and being able to provide care for them, because this was a disease that had a very short life expectancy. And even from a macro base, I launched our first awareness walk last year with a group of other caregivers, just to raise awareness and strive even the importance of sickle cell. So I definitely see how it all intertwines. Looking at, the public health piece to me is providing both a business aspect but also that research. And I'll admit, when I did my master's in social work, wasn't really crazy about research, but public health has kind of spun it a little differently. So with that, it's really gotten me excited about, okay, if I can do the research, I can bring the numbers, I can show the gaps, and then this is how upper administration, upper leadership will say, okay, yes, we need more social workers here. We need this here. We need this there. So I'm really excited about where this next leg of my professional career will lead me.
Yeah, so exciting. I mean, you get me all excited. I don't even like research.
Yeah.
But yeah, that's so amazing.
Yeah.
And I love that you talked about your experience with CPS or Child Protection Services, because I talk to so many people who are in their graduate program or in their bachelor's program, and they're saying, all I've done, quote, all I've done is CPS. And I try to reiterate that's a lot. And that does also not have to be the end of your journey. Like that
It
is
does
not
not.
all
It
there
does
is.
not.
Yeah. So
And even, as I reflect on it, I even recall the disparities within the child welfare system, knowing which families got, certain populations, Black and Brown people were called on more than non Black and
mhm,
Brown people. And, they were a high percentage of those that were also in the court system, the juvenile court system, and educating them, people being fearful of, oh, I think I have to comply. It brought and truly helped me understand, what is a true emergency. So, not to say that in the medical field we don't have emergencies from a social work standpoint, but it's very different. And there's a lot more of crisis planning in child welfare, and so I'm able to bring those crisis planning skills into the medical field, but kind of being more proactive. So I'm able to forecast potential situations and problems and say to providers, hey, they don't have support. This is not going to go well for a transplant patient because they don't have all the necessary support. We have a single parent here. We need to kind of rally around them, this single parent, to get them, more mental health support because they're saying they're overwhelmed. And thinking about moving forward with their child with this major step of having a bone marrow transplant, it's life changing. And trying to be more proactive and putting things in place so it gets me to be more proactive and encourage the medical field and the providers to be proactive instead of
right,
reactive.
right, which is all about medical social work. I mean, those two
Yes.
those two industries are so close together. So, listener, if you did not just hear what Milvon had to say, she essentially gave you the words to use if you're looking to switch from a CPS position into medical social work. She just told you exactly what to say in an interview of how your skills
Yeah.
relate to medical social work. So rewind, take some notes in case you missed that.
Absolutely.
Thank you. So I'm wondering, okay, as a pediatric social worker, what would you say, kind of in a nutshell, what is your job?
So, my job is to really look at the social determinants of health, kind of help families and patients, support them through their medical diagnosis, treatment, um, and address any social, emotional issues that they may have, any barriers they have to accessing care. One thing that a lot of people think medical social work is a lot of discharge planning. And while we do have some social workers that are under like our care management discharge planning, that's not what I do. We have a separate nurses that do the discharge planning where I work at, and it's great to not always do discharge planning. Doing true clinical work, meeting a family in an outpatient visit, and they're struggling emotionally with whatever, and being able to process, give them some of the necessary coping skills, and then being able to check back on them when they come back in like 2 weeks or later that week and saying, hey, how did this work for you? Did it help when you did some relaxation techniques? Did it help when you did some yoga or some mindfulness? And really even introducing some of these concepts and making people feel comfortable with using them, because there is a lot of stereotypes and stigma associated with mental health, seeking help. And so kind of introducing some simple things of such as breath work, oh wait, like actually demonstrating it. Oh, okay, like they're like, oh, that wasn't that bad. I feel better. Like, thank you. And really getting them to buy in. That is a major part of what I do on a daily basis. Now, of course, in social work, there's always documentation. So documenting these interactions. There's no formal like case plans or treatment plans in medical social work for us. It's really just documenting our interactions. And we do make plans, like action plans, but they kind of more tie into whatever the provider's plan of care and how we can best support the family through their situation. And, then there is community outreach, doing programming. I'm also a team lead for our pediatric social work department. So I supervise 4 other social workers, and just kind of being able to kind of provide them with supervision, triage any cases, be there to support if they're having challenges with some of their providers as well. And, so being part of the leadership team as well is a nice added bonus because I'm still doing the work, still carrying a caseload, but also able to kind of support and do some more higher level macro based things as well. So it's the best of both worlds, honestly, for me. And I think even not being in leadership, I was able to do that because I had a very supportive manager.
Yeah, I love that because it sounds like you get the micro, the individual, and then also the macro, the community. You're seeing how laws and policies are directly impacting the patients that you work there with. So I love it. Thank you so much for sharing.
Yeah, absolutely.
Hey, it's Catherine here. I hope you are enjoying this episode. We're going to take a quick break to listen to these ads from our sponsors. The next time you need continuing education units, I highly recommend the Therapist Development Center. When I started this podcast, I reached out to the founder, Amanda Rowan, to see if she was interested in being a sponsor. And she jumped at the chance to support her fellow social worker. TDC has helped more than 100,000 social workers pass their licensing exam, including myself. I love that TDC CE courses are engaging and relevant. Amanda and her experts give us clear and practical clinical skills that we can immediately apply to our work. Some of my favorites are the Edge of Life Suicide Prevention course, where Amanda shares her personal experiences, and their They Did What Law and Ethics course that looks at real cases where therapists face formal disciplinary actions. They also have a great telehealth course. We are legally required to take continuing education to increase our competence, and most other courses out there don't actually teach the material in a way that we can learn it, but TDC does. You can also check out the links in the show notes. Also, so I'm wondering, what would you say is the most challenging part of the work that you do?
I think one of the most challenging parts is getting the providers to understand and the importance of meeting these patients and families where they are. I think that's something that we as social work do really well. And I think sometimes for providers, it's hard to understand, what do you mean they don't have any family? It's just mom and dad, or it's just mom and caring for 2 siblings. What do you mean they don't have extended help, support? What do you mean they can't pay their bills? So that's why they're missing the appointments. They just, sometimes it's hard for them to understand why people are not prioritizing their health. So really kind of humanizing it, and saying, if you don't have a car or you don't have lights on, you're not going to come to this appointment when your child is appearing healthy right now. Like they're not showing you any signs or symptoms of illness. So if your lights are about to be disconnected and you need to go to work, you're going to go to work to prevent your lights from being disconnected. or even simple things of understanding from an inpatient side how sometimes I don't understand why don't certain people you like why are they not washing their hair, why are they not showering, and culturally maybe they it's not a cultural norm for them to bathe every day, or if you have someone of a certain ethnic background, they don't necessarily use the products that the hospital has to shampoo their hair. Like that's not going to help, or the soaps, it's not good for their skin. And so just it's a lot of education.
Right.
And educating on both sides can be kind of challenging sometimes. And how do you balance that? And making sure that you're there to support the families and patients, but also there to help support the providers as well. And then to kind of help everybody meet in the middle.
Yes, I've heard doctors multiple times say that social workers bring that missing piece to the clients and to the cases because they're just looking at the medical documents and they'll say, "Why have they missed so many appointments? What could possibly be more important than this appointment?" But when
Right.
you add in all of these other dynamics like, "Oh, well there's addiction," or they only have a single parent and they have to go to work because they can't get fired because they have to pay their health insurance, right? So all of these different
Right.
dynamics that are at play here, we really bring the missing piece to.
We do. We do. And sometimes too, we're blue in the face of explaining like they have two medically fragile children. And so it's hard to and so they can't leave the one child to bring the other child, there's not a lot of people they trust and trying to help them understand that. Yes.
Yes. Oh my gosh. I can't even imagine being a parent and having to go through this type of situation of having a child who is sick or two children who are sick. I mean, I gotta have like a like a emotional mental boundary there because that's so easy to kind of go into this spiral of like of taking it on yourself. And I'm wondering for you, how do you set that emotional boundary? Because you yourself have children and grandchildren that are probably around the same age as some of your clients. How do you not take this work home with you?
Um, so I am very big in practicing self-care. And I think I learned that during my child welfare days when I felt like I was just running all the time and wasn't taking care of myself. So I self-care is really, really important to me. So if that is now that the weather is finally breaking here in Ohio, we're getting warmer days. So if it's I've had a very heavy, conversation with a patient, it's kind of weighing on me. I may, instead of going to the office, I may go take a walk and, take a couple of walks around the building, and just getting that fresh air, getting that sunshine allows me to recenter. Also doing some other little small micro practices throughout the day have been helpful. And even as I'm transitioning from leaving physically work to home, some days it's the car ride with no music or like some soft calming music. Maybe it's, just or it's something more upbeat. It kind of varies. And then when I come home, some days are heavier than others. And I just have now trained my family to understand that if I go straight upstairs, I kind of say hi and go straight upstairs, I might need like 10 or 15 minutes and just kind of, doing my own breath work and leaving it there. The I will say one of the pluses of medical social work is I am able to leave it there. It's not being on call. So, I work my normal, 8 to 5. And for most situations, I am able to leave. Now, obviously, if there is a patient that is maybe not doing well, it may weigh on my mind. And so then that evening, I am probably trying to do a little bit more self care to be present and mindful when I am here with my family. But self care is really a big component. So taking those days off, not working all the time are important, and recognizing and when I need those. And when I just had a mental health day. And luckily, I have a very supportive manager who is all about self care and does, supports that. So, the other day I was like, okay, it's been a lot. I think I need a mental health day. I'm going to use, I'm taking PTO. And she's so supportive, as well as, my coworker who is also another team lead is like, yep, I got it, and we support each other. We talk through cases, so that's nice as well. So lots of ways I try to leave work at work, or at least if I'm bringing it, allowing myself to really be present when I'm here with my
Yeah, and
family.
thank you for normalizing that because I found that no matter how long you've been in social work or that you've been doing this work, it is hard, and self-care and creating those boundaries and that space for you to be well is really a professional skill that we have to also develop on our own to be able to recognize, one, get in the habit of seeing how am I feeling, and two, saying, okay, now that I know how I'm feeling, what is it that I need to help get myself back to baseline,
Mhm.
to reduce the stress, to unload this heavy emotional weight that I'm carrying. And I myself don't have one thing that works. And I don't think that's how we operate as
Yeah.
humans. So I love that you mentioned a wide variety of things that you do for self care. Is this a conversation you have in supervision too?
It is. And I really encourage those that I supervise, as well as that's something big that my manager kind of instills and has a conversation. And it's so nice because I am even able to tell that to my patients and families, to my parents. Like, I know your child is not doing well, especially when they're admitted, but like self care is, getting out of this hospital room and walking down to the cafeteria, to Starbucks, Panera, grabbing you something to just eat and just kind of getting out of the four walls of the room, right? That is self care. And making it something that people can feel is tangible is also helpful. Now, I have my moments when I'm not always, I think we all do, when we're like, oh, wait, I'm overdue for, I'm feeling it
Yes.
build up. But being able to be aware and catch it and say, all right, it's time. I need a day off. I need to go book a massage. I need to go get my nails done. Whatever it is, I need to take care of me.
Yes, yes, for sure. Like today, I had to take a nap. I'm just like, I am so mentally tired. I just need a nap. And I know that's like a really big luxury, but some days, you just got to do what you got to do. Um, so I'm wondering for you,
Yeah.
what is the most rewarding part about the work that you do?
So for me, it's a couple things. So working in oncology, obviously that's cancer. So when my patients are able to get in remission, stay in remission, successfully complete treatment, that's always a win and ring that bell. So that's a rewarding part. The other thing is, when I have that patient or that parent kind of come back and say to me, I tried that breath work, or I tried that journaling that you said. I actually just took 5 minutes and I locked myself in the bed, whatever it was, and it, like, I felt so much better. It warms my heart that I've penetrated, because I look at a lot of times, they are thrown so much information of like, you have to do this, and I look at my role is sometimes just planting seeds and then just kind of like watering them. And so when I see them actually kind of start growing, it's like, yes, like, great. And and they're like, oh, like, and it really helped. And I'm really thankful that you did that. And I'm like, and I'm glad that you felt that it worked for you. And I hope that you continue to do it. Without that pressure, right? Because I feel like so much in the medical field is all about pressure. You have to make this decision here. You don't have to make this decision right now. I'm just planting a seed, kind of saying, maybe you want to try this. And then letting them kind of warm up to it on
Right,
their own.
right. And I have used mindfulness and deep breathing in the medical setting as well. I talk about it in the course that I did, the Clinical Essentials for the Future Therapist, because it's an
Okay.
underrated skill that you can teach, or even just an intervention that you can do with people who are so
Yes.
anxious. So, and just the act of breathing for 1 minute intentionally, man, it makes so much of a difference in their ability to
Yes.
focus and just calm down and be able to hear what you're saying.
Yep, absolutely. I have like seen it be like light bulbs when I'm like demonstrating and then they actually participate. They're like,
Yeah.
oh, like,
Yeah,
yeah.
they think you're kinda off your rocker at first, like, "No, girl, I don't need a breathe, I
Hmm.
need answers." But
Right. I need them
yeah.
now. Like, okay, let's just pause. I always like to
Yep.
start pause and let's just take a nice deep breath in. And then it's like, oh, okay, I guess I did need them.
Exactly, exactly. Yep, love that. So, if somebody is interested in pursuing this line of work, where what could they do to start out? Is there a training that they take? Can they volunteer somewhere? Are there entry level positions that can help prepare them for this type of work?
So most hospital social work does require at least a master's in social work. I think, and one of the great places that they can start if they're pursuing their master's degree in social work is doing an internship. A lot of the schools partner with local hospitals and then they reach out to social work departments and people come in and kind of do their internship or shadow for a day. I think that's definitely a great place to start. Volunteering, getting out, yeah, making connections. I would say also talking to your professors if you're truly interested. Hey, you never know what kind of connections your professors may have to different hospitals or, nursing facilities, because there's so many different types of medical social work. And really just kind of getting out there and looking, and just even if you see someone that is like, oh, like you do medical social work? Oh, can I ask you a couple questions? And definitely, reaching out. There's so many different Facebook groups that I'm a part of as well that kind of, and it's so interesting to see people all over the world that like, okay, we're having a similar like issue. It's not just here because sometimes it feels that way. It's got to just be here. And I think those are great starts of just reaching out because you never know. Networking with social work to me is just so huge. You never know who knows who that could connect you.
Definitely.
But from a training, you have to have a medical, I'm sorry, a master's in social work. That's what most hospitals require. And then most hospitals, then you get the masters, you are LSWs, and then depending on the particular state, it could be a LCSW, LISW. Every state I know is kind of different with their terminology for
Yeah.
a degree.
Yeah. Awesome.
Degree. Yeah.
Yeah. Same here in California. So in California, I've seen a lot of positions. They say they require an LCSW, but so many hospitals are just desperate for social workers that I've seen new graduates straight out of their master's program get hired. Listener, if you do not meet every single qualification on that list, still apply. Don't discount yourself. Don't
Yes.
count yourself out because you don't know what the needs of that organization are. So just go ahead and apply. If you meet, 60% of them, send it in. Send it in. Because also too, sorry to cut you off, but the great part
No.
that I also like and appreciate about medical social work is there's a decent amount of money that can be made within medical social work. I did a quick search today and found that pediatric social workers, the range is pretty big. You can expect to make anywhere from 55,000 per year up to 78,000 per year, and that's just the average. So you could, be making less, be making more, depending on your experience and your location. So I do appreciate that about medical social work.
Yeah, and I was just going to add, you never know like what kind of skills you're already bringing. Even if, like you said, Catherine, you don't maybe check all the boxes of the qualifications. A lot of it is, like I said, some crisis planning, being proactive, thinking, kind of coordination, all of those things. And you may already possess those skills and be doing that actively. So, submit that application. You never know. And then sell yourself, and because you already have the skills. Trust me, when you do your interview, you already have the
Right,
skills.
right, exactly. And you can even use personal experiences too. If you feel that you learned a lot from your personal experience and you're not still traumatized by it, then it can really help you. For example, I was raised by my grandmother and I saw what she went through going to a nursing home and going to the hospital, being very sick. And I could use that in my interviews and say, I saw from a family's perspective. So this increases my ability to empathize with the family. It gives me a different perspective on the questions to ask, on how to cope, how to check in with them, the resources that they may need at home. So you can use your personal experiences too when going into interviews.
Absolutely, absolutely. And I think that does make you more relatable. And honestly, having recently done interviews, we want to see the personal side of you too. We don't just want to hear the textbook version or the school version. We want to hear, what do you like to like? What are your skills? But we also want to know, how do you balance um, the work of social work, because it is challenging. So, what do you do to take care of yourself? And then, where do you see yourself? What kind of growth would you like to have in the next few years or
Yeah.
so?
That's a great question. What do you look for in interviews when social workers come in?
So I think, one, we look at their experience of interacting with, in a pediatric world, obviously, anything with the family system. It doesn't necessarily have to be ped specific, but working with the family, because the family system is what you're going to work with in peds. Yes, the child may be the patient, but you're working with the parent too. So any kind of skills along that piece of, your any kind of work that you've done with families, how you've kind of maybe helped families process some difficult situations, some crisis planning, clear documentation. What kind of interventions have you used? And a lot of what we do are interventions, like we talked about before. Deep breathing or breath work is an intervention. It's not always, oh my goodness, we did, cognitive behavior therapy during this session. It could be just simply breath work. That is an intervention. Um, Also, I think, ability to advocate and, really truly assess situations. I think so much of what we do as social work is assessing assessments. And whether we're assessing as we're talking, doing a formal written assessment, all of that, your ability to assess. And then we do want to know that personable side of you. What is your life outside of social work? What do you like to do for fun? So that's why I also kind of threw in there, like, when I have time, I like to
Yeah.
read, go and spend time with my family. So
Yeah. Thank
yeah.
you. I love that. I love that. So, as we're closing out, where can listeners learn more about you or get in contact with you if they have any questions?
Um, so I would say, I'm not a big social media person just because of social work. So I would say my Instagram. And I'm working on getting a LinkedIn. So I will send you that information for my LinkedIn, because I'm in the process of finishing that, because I thought about it. I was like, oh, I probably need to. But being a social work and knowing that people do look for you. So it's kind of caused me to limit the amount of social media that I do, just because. So yeah, so I will send you that my LinkedIn after this interview, and so then that way it will be a great way for people to connect and ask me questions. And I encourage anyone to ask any questions. There are no silly questions. I'm learning every day, even as a medical social work. I haven't seen it all. So there's still new diagnoses and things of that nature. And don't get bogged down with trying to, oh my goodness, I need to understand diagnoses. That part comes with the job. You will learn those things. Um, it's the things that are already in you, like that empathy, that compassion, that ability to assess and discern and support. Those things are the things that are going to get you in the door, and you will learn all the other stuff, the medical terms, and that will be the fun part, the fun and confusing part.
Right, right, exactly. So if you are going to an interview again, I hope you're taking notes on this because these are some golden gems that Milvon is sharing with us. So thank you so much for your time. It was so amazing to talk with you, and we'll see you next time.
Thank you so much.
Thank you for listening to another episode of Social Workers Rise. If you love this episode, be sure to subscribe and text this episode to a friend. If you want more, there are a few ways we can get to know each other and work together. First, definitely subscribe to the Friday resource email list. The link is in the show notes. And that's where you can learn more about the courses I offer, including Clinical Essentials for the Future Therapist and the Pulse Basics for Medical Social Workers. I'll also be sending out occasional tips and resources and other happenings within the social work industry. And for all your clinical supervision needs, be sure to visit risedirectory.com. This is a national directory of clinical supervisors for social workers, and we also provide free resources that you can use within your own clinical supervision. Lastly, if you have more individualized needs, I do offer coaching, individual consultations, and am available for public speaking engagements for social workers and change makers. Lastly, the boring legal stuff, but very important. The information in this podcast is not meant to be a supplement for therapy, professional advice, or clinical supervision. This content is provided as is solely for informational purposes. It is not legal, health, or safety advice. I am not advising you as a therapist. Organizations should engage their own experts to ensure any adopted measures are compliant with applicable laws and standards in their jurisdictions. The opinions expressed by individuals or organizations are their own and do not reflect the views or opinions of Social Workers Rise or Catherine Moore. References to specific products or organizations do not constitute any endorsement or recommendations by Social Workers Rise.